Are you suffering from low back pain that goes into the hip, maybe wraps around the thigh? Well, you might be suffering from a problem with your SI joint or your sacroiliac joint. My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley. And today I'm going to talk all about sacroiliac joint sprain, what it is, what it might look or feel like, and what you can do about it. So first, let's talk about the anatomy. The sacroiliac joint is formed by the sacrum, or the tailbone, and the ilium, the pelvis. So there's one on each side. And there's not a lot of movement here, which is where the problem starts. Because if we were to, say, lift a box far away from our body or with our pelvis tucked under us, or maybe we don't have a lot of true hip mobility, our hip joint is right down here, then that force is going to transfer into that joint and it could potentially sprain it. And a sprain just means an overstretch of the ligaments that attach that joint together. Also in this area, in any part of the spine where there's a transition, where we're going from a curve in one direction to a curve in another direction, that leaves that area a little bit vulnerable to injury. And in the lumbar spine, most of the joints, L1 to L4, they go in what we call the sagittal plane. But then that last joint, that L5 as it meets the sacrum, it switches and it goes more in the frontal plane. So that leaves that joint, in addition to the sacroiliac joint, a little bit vulnerable to injury. Now, how are you going to know if you're suffering from an SI joint problem? Well, you might have pain that goes down into the buttock. You might find that your range of motion in your hips is a little bit restricted on one side or the other. You might even notice that you're walking funny, or things like putting on socks, standing on one foot while you bend the other are tricky. I often hear that slight bend, either washing dishes or brushing your teeth, washing your face, that is the most painful position, because right when we get to that angle, that's when we really aggravate the sacroiliac joint. Now, what can you do about it? Well, it's important for you to come in and see us and get properly assessed, because that what we're describing can also mimic a few other problems. You could be having a problem with your disc at the bottom of the spine that's sending a sciatic type pain into your glute. You could actually have a problem higher up in the spine, which can also send some wrapping pain into the front of the thigh. And we also want to rule out anything with the hip joint itself. So once we've determined what's going on, if we think it's your sacroiliac joint that's part of the problem, then we'll do some soft tissue or muscle work on the glutes in that area, as well as the piriformis, all the muscles covering that hip. Then we might also work on the dorsal sacral ligament. That's a ligament that attaches from the sacrum to the bottom of the pelvis. Make sure that's moving well. Then we'll likely do some kind of adjustment, either with our impulse adjusting tool or with our hands, or maybe our hands and the table, which pops up and drops out. We want to get the joint moving a little bit better to decrease the pain. At home, you might find that ice on the sacrum itself is soothing, and then sometimes I suggest people put heat on the muscles of the low back, because what tends to happen is they can kind of tighten and spasm a little bit. Cat-cows or pelvic tilts throughout the day can be helpful to loosen things up. And right now you actually want to avoid stretching your hip muscles. So any of that figure 4 position where you cross one leg and open up the hip, we want to avoid that right now. We want to think about symmetry from side to side and just moving in the front to back plane. So we don't want to add any additional torsion or rotation in there. So avoiding twisting right now is also helpful. If you're trying to go back to yoga or the gym, you want to keep your lunges or your split squats smaller, because we don't want pulling into opposite directions. You can check out the video I made about exercises for SI joint pain to get more ideas. If you think that you're suffering from sacroiliac joint sprain or pain, book in with us at willowbrookchiropractic.com. We post regular content under Willowbrook Chiropractic on YouTube, Facebook, and Instagram. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.